everybody, welcome back to my YouTube channel. This is Dr. Rosi, your friendly family physician. In my last video, I spoke about acne treatment, why acne happens, and what over-the-counter products we can use to treat mild to moderate acne. But today, I'll be explaining within those treatment options, how do we apply them? What comes before what? How often? What should I look out for as side effects? So those kind of questions that we have a lot of because there's so much information out there, we don't know where to start with the amount of products that are out there. So I'm going to just simplify it very basic with a few tips for you guys, okay? Let's do this. Number one, always start by using 1 to 2 active ingredients. We don't need to go all funky, hazy, doozy there. Just take 2, okay? 2 things, 1 or 2, especially if you're starting with nothing. If you're starting with a cleanser that has an active, you could start simply with that. Plus a moisturizer. Always moisturize because there's no actives in a moisturizer, theoretically. So again, 1 to 2 active ingredients plus moisturize. That's step number uno. Number 2, I'm gonna go by product. So if we're talking about salicylic acid, the BHA that I mentioned in the last video, here are a few examples that you can find either in a cleanser or alone in a type of serum or toner form. Here's the thing, it does tend to dry up your skin. So moisturizing is super important. The other thing, it can make you a little bit sensitive or irritated, so you don't necessarily want to combine it with a retinol or retinoid, because the combination of both of them, especially if you're not used to chemical exfoliants or retinoids, is a no-no, and it's probably going to just make you back off entirely, and then your regimen goes to the right. So you want to start slow so that you can kind of customize your skin, don't shock it, and don't combine these 2 ingredients. Next thing I want to mention, so benzoyl peroxide is quite well tolerated. So if you have sensitive skin, I would start either with azelaic acid or benzoyl peroxide. You don't need both, and you can use them either AM or PM. They don't necessarily make you sun sensitive. However, SPF is always recommended in any case. That being said, benzoyl peroxide is more often used as a spot treatment, and whereas azelaic acid is used kind of all over the face. You could also use benzoyl peroxide everywhere, but it tends to leave a white cast. So if you're using it in the daytime, it might be less aesthetically pleasing, or you might just want to put it at night. Keep in mind though, it could bleach your pillowcase or your clothing a bit. Hasn't happened to me, but it could do it in theory. So I do advise my patients of that. Next tip regarding retinols or retinoids. People often don't know how much to use, where to start, so it's always a pea size, literally, for your entire face. Do not spot treat. That is counterintuitive, because then you're not kind of preventing other lesions. So if you put it everywhere, you're going to just treat everywhere, and that's the purpose of retinoids. Start them in the evening. Still put SPF in the daytime, but start them in the evening because they tend to cause irritation of the skin much more than the other products that I mentioned. So if you're using a retinoid or a retinol, use it in the evening, use a pea size, use it all over your whole face, and don't use another exfoliant or active at the same time. Start only with that, and then moisturize afterwards. So you know how I mentioned in acne, the other acne video, that you should moisturize even if you have acne? Well, you should definitely moisturize if you're using a retinol or vitamin A derivative. That being said, if you're using a prescription-based retinoid, you may have even more likelihood of drying out, and therefore you want a stronger or more effective occlusive or emollient agent to help hydrate your skin. Even something like petrolatum jelly, like Vaseline, would be indicated, and it wouldn't necessarily worsen your acne, even though we think that way. It's a really good idea to use that to protect your skin after using an active like a retinoid. The other thing about retinoids, so these have maybe the most information, also don't use them if you're pregnant, but again, always discuss with your doctor about this, is that it could take some time to actually work. It could take up to 6 weeks before you see any changes. So I would not lose hope until it's been a good 4 to 6 weeks before saying it worked or it didn't work for you. Next, I do want to say, here is the order of how you should do things. Number 1, cleanse. Number 2, use your chemical exfoliant or your active ingredient if you're gonna use one. Again, salicylic acid may be a chemical exfoliant already in your cleanser. I prefer that combo because it's like a 2-for-1, you get out of the way. Next would be apply a serum if you do that. Not everyone needs that, but if you're one to use a serum, this is where you'd use it. And then you use either a retinoid or a moisturizer first, whichever one, or moisturize and then retinoid, it doesn't matter. Basically, smallest molecule to largest. In this case, if you're a beginner and you've used nothing yet, I would say either use a salicylic acid-based cleanser or benzoyl peroxide, and then finally end with a moisturizer, or just one of those. Or cleanse with no actives, use your retinoid, and then moisturize. those are kind of the two ways I would go about if you're starting from zero. Hope that was clear. If you guys have more questions, please link them below and I could do a follow-up video. Wishing you all the best. If you did enjoy this, if you did learn something, please do subscribe and like this video so that you don't miss other informative ones.